Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello, and welcome back to the Sit and Stay podcast brought to you by RipsyTech. As always, I am RipsyTech product manager Parker Anderson, and I am joined by RipsyTech founder and CEO, the magnificent Tom Tarshis.
Thanks, Parker. Maybe like frazzled is a better word for today. Well, maybe not
Frazzled Tom Tarshis.
Discombobulated. No.
Discombobulated. There you go. Well, hopefully this episode does not come off as discombobulated. If it does, actually, if the edit comes out great, it won't. Anyway, we have a good episode today. We are going to be talking about scheduling strategies. It's a pretty big topic. But before we dive into all of the nuances that exist in that very, very complicated topic, how are things going with you?
Good. Yeah, lots of exciting things happening, both from our nonprofit clinic and with RipsyTech. So it's super busy, but it's sort of that when you're passionate about things you do, you seem to find the energy to stay up late because you can't stop doing the next exciting thing, and that's,
I know the feeling.
You know, when you do that and then you're like able to be happy and still excited to stay up later to the next night, that's a good feeling. Or it's psychopathy around my inability to balance work and life, Parker. But
well, yeah, don't burn yourself out. That would be my number one thing. You know, I've definitely found myself in eras of being extremely excited about something, and then I just try to go all in. I try to optimize it. Maybe at some point I whip out a spreadsheet. I'm trying to really time manage. How can I fit in all the time I can on this one thing? And then before I know it, I've spent way too much time on it, or I spent too much time planning it and not even actually doing it. and then I'm just burned out. So that would be my advice.
Yeah, no, I got you. And, you know, on the podcast topics, and, you know, there's still, you know, we've done 50 plus, and there's, you know,
this is the 60th episode.
Oh,
actually.
60th. There you go. And it still feels like there's infinite things to discuss. What I tend to do when you're like, hey, Tom, what should we talk about next is, yeah, what have I been doing in the clinic, or like what's been on my mind and thinking about? And I think when you asked the question for this podcast, it was like, you know, let's talk about scheduling, because looking at new providers coming and philosophy and helping some new people set up their practices, I feel like I've been talking to a lot of people about scheduling. So let's do a podcast.
Yeah, it's been very top of mind. We are actively in development on our patient portal, and part of what that includes is the ability to automate your follow-up appointments, you know, having patients self-schedule their follow-up appointments and not requiring you to do it yourself, which is, you know, a big quality of life upgrade that some providers might hope to have. But as we're figuring out, it's not as simple as just saying, hey, here's the link, and, you know, here are the times that I'm available. Go ahead and schedule whenever, because there are so many little nuances to clinical care and how often you see somebody. And, you know, you don't want to find out that the patient you said, yeah, let's meet again in 8 weeks, took your Monday morning appointment for the next 3 weeks in a row, and, you know, then you have to spend time cleaning that up. So, you know, there's a lot of like little nuancy situations that you know, we're trying to figure out the best way to, you know, make things as desirable for what people are looking for when they're, you know, going through this process. So not all of that is on the software, though. Some of that it can be, you know, sorted around operations and how the business you know, just does things in general. So I think that's, you know, what we're focused on a little bit more today. So let's talk about, yeah, what kind of scheduling strategies are there? Why is it an important thing to be keeping in mind for your mental health practice? And, does it have any impact on patient care and provider sustainability? And I guess really, I'm packing a lot into one question here, I realize, but provider sustainability in the sense of, not getting burned out.
Yeah. Yeah. No. And I think, yeah, you're right, Parker. I think as we get close to, in a few months when we're close to releasing the actual patient portal with that auto, you can already do your assessments, but
right.
There's a full episode to talk about both the scenario you mentioned and scenarios where like, oh yeah, here's the link, follow up within 6 weeks, and then they never click it. And then they say, right, hey, where's my medicine? And you're like trying to squeeze someone in to be a good, like there's lots and lots of things to discuss there. But yeah, today we're just talking about kind of, there essentially in your field as a mental health clinician, you have 3 standardish blocks of time for appointments. And I would say 30 minutes, 45 minutes, and 60 minutes are those blocks. For people in cash practices, you could have more. You could have a 90-minute appointment or a 120-minute appointment. I think the reason those are less standard is because you can't really bill for sessions of that length. Asterisk, like emergency sessions, or there's a way to do time-paced billing, but it's not the way I would recommend that you set up your structure to have visits that go for a long period of time. To your question of like patient care and provider sustainability, this goes to what type of practice are you running? So if you're a therapist or a psychologist and you're doing mainly individual psychotherapy, you want to think about your availability to provide follow-ups to your patients at the right frequency. And we have some best care and best standard guidelines, which, weekly therapy visits are the gold standard, and sometimes even twice weekly. That being said, are you someone that really likes that weekly repeat of frequency for your therapy patients? If it's every other week, is that okay? How many patients are you going to be taking in? And do you like to sort of do back-to-back sessions that may leave 0 time for documentation and then give yourself other built-in chunks of time? So there's all of these variations that every clinician should think about as you've gone through your years of training, like what feels best to you. And the nice thing about starting your own practice is you have ultimate flexibility on deciding these pieces. There is a piece for providers or prescribers that, going back to looking at your budget and how much you need to earn per hour, the reality is as a prescriber, you'll earn much more doing 2 30-minute sessions in an hour versus a 45 or 60-minute session.
I was going to ask about that.
Yeah. There are prescribers who see 4 people in an hour, which would lead to burnout and feeling like I wasn't providing good care very quickly, but it is something that happens. Again, not recommended. So there is sort of a budget and how much money do you need to earn factor here. And I'd say, the final thing that has impacted sessions, since I started 20 years ago was it used to be very standard to sort of do a 45 or 50-minute session, and then you have 10 minutes to get your note done. Right now with AI, and so even with RipsyTech AI, if you're getting your notes done in 2 minutes, hey, maybe you're going to push for 55-minute sessions. So then you hit that next time threshold, and then essentially you're doing the 60-minute sessions instead of the 45-minute sessions. And that can bring extra reimbursement, or a lot of providers for certain patients need that extra time because they just can't get through the material. So there are lots and lots of things to think about. But as you said, the most important thing is, what do you like and what is the overall schedule and session lengths that help you not feel burnt out?
So, how might scheduling look differently for an intake appointment versus a follow-up appointment? Because, I mean, follow-up appointments, I imagine most of your schedule is follow-up appointments, but then, if you're going to have new patients coming in, and, we have talked about in the past on the podcast that, success, well, I don't know if success is the right word, but, patients see their mental health providers to hopefully not have to always see their mental health provider at some point, to successfully discharge, so to speak. So it stands to reason that doing intakes often, or at least at a regular cadence, would have its benefits. So yeah, how do those two things differ in terms of strategy?
Yeah, and it's a good question because a lot of people in their training, they may be exposed to a certain time to do an intake. For example, especially providers that work with kids, a lot of people are maybe used to a 90-minute intake appointment. And so then people finish their training program, and there are lots of unique ways of billing that happens within people's training. But when you come out to the real world, one of the important things is you almost never have enough time for intakes when you're doing your training or learning the process. So one of the big advantages is being able to change the way you do your intakes in your own practice. So I always recommend to people, don't do those 90-minute evaluations. They're hard on everyone. It's a long time with you. The note is, can be very burdensome. Well, maybe not with AI, but it's not great to have sort of people in the waiting room when you don't need them to be there. And ultimately, you don't get to bill unless you're a pure cash practice. You don't necessarily get to bill more for those longer sessions. So I always highly recommend to people starting out, make those intake sessions 45 minutes and schedule multiple ones on different days. And there's a lot of value for kids or adults to see people on different weeks, because anyone can be having a bad day or good day. So seeing someone with some time in between is a great way to get a better picture of how they are doing when you're doing the assessment. So our standard is to try to keep four 45-minute appointments to cover meeting parents, meeting kids, doing a wrap-up session. For adult patients, to try to do it as...
And that's for an intake.
For an intake. And for adult patients, to do it as 2 sessions. I will say that even though the goal is 45 minutes for those appointments, those are the type of ones where you wouldn't put 2 of those back to back, because the first time you're meeting a family, those sessions are very likely to go over. So it is something to block 60 minutes, even if your goal is to try to get the information you need in 45. For the follow-up visits, even if you're a therapist, there are bill codes for doing, 16 to 37-minute therapy sessions. And there are patients that just do better with weekly 25-minute sessions versus every other week 45-minute sessions. And so it's something that actually doesn't happen maybe enough in the field, that there can be benefit to these 25-minute weekly therapy sessions, especially if you're doing a very structured therapy or you have a very active and engaged patient. You will, at every level of provider, you make more per hour when you do 2 sessions in an hour. So I think therapists and psychologists being more open to having these 25-minute therapy sessions is something that I wish happened more. But I think in general, a lot of patients and the providers know that most therapy sessions are 45 minutes. There's a lot of jokes about, when is an hour, not an hour, when you're seeing your shrink, then it's only
Right.
50 minutes. I don't
So,
like,
well, that
and sorry, the last comment is I don't like doing the 50. I think when I started, I did 50-minute sessions because that's what we had done in training, but you don't get extra money for that extra 5 minutes. And really the goal is 45-minute session, do 40 minutes of engagement with the patient, and then go to your calendar and review what's coming up, doing scheduling, anything with pharmacy, and that's the last 5 minutes of the session.
So I actually want to quickly backtrack to something that you said, which was related to the number of intake appointments that you choose to do. So in your case, you said, yeah, 4 appointments for a minor and 2 for an adult. And I'm wondering, is that a psychiatrist specific thing, or is that does that apply to all types of mental health providers? And the only reason I specifically asked that is just speaking from my own experience. I mean, I've never gone to see a psychiatrist specifically, but I have seen a therapist or 12 over the years, and I feel like I've only ever had one intake when I go to actually meet with them. Um, so I'm kind of curious about that, like 2 intakes. Like, I mean, or are we all doing 2 intakes and we just don't even realize the second one is still an intake? I'm a little curious about that.
Yeah, no, great question, Parker. And I like how you shift the podcast to be very specific to, your situation. But
Well, I think it speaks to, we got to remember, like, what are the patients actually experiencing? And I'm not shy about saying, like, yeah, no, I've been to therapy before. I love therapy. Everybody should go to
yeah,
therapy.
yeah, yeah.
So yeah, as much as I can say, like, oh, hey, wait a minute, I've seen this, so I'm gotta keep you on your toes a little bit.
No, no.
And
And actually it's like it's perfect when you sort of when we both bring in personal experiences, it keeps it sort of real. And, it's really impossible to get to know someone in 1, 2, or, probably even the 4 intake sessions. And so whether or not you're told there's one intake session and then you're jumping right into therapy, there's definitely pieces of your life that haven't been gone over well in that first 45 minutes.
right,
So what we phrase for adults is, yeah, come on in. I'm going to get through a basic history. We're going to give you some questionnaires. But then in the second intake, we're going to dive deeper on parts of that history that need more attention. And then the goal is sort of at the end of that second session, that information plus the questionnaires, then we can sort of go over some of the results and talk about diagnoses and treatment planning. And that's for all like mental health professionals, because there's other risks to quickly, it certainly happens, but I would never, very, very rarely, less than 1% of the time, do I ever like write a prescription for anyone I've just met for the first time.
makes sense.
It does happen in a lot of entities and other practices, but and it's constraints of the mental health care system maybe more than anything else that happens. But I'd rather just keep it real with the patients that, yeah, we can go through everything quickly and maybe get a little accuracy after one intake, but let's at least do 2 so that can go deeper on certain topics and have a little time to review some objective questionnaires, and then have set time to talk about actual treatment planning. So that's a big part of an intake is, here's things that could be helpful, but let's talk about it and what you would like. And so that's why we call it very direct with like 2 intake session.
That makes sense. I mean, that answers my question. Okay, let's transition into the next question I had, which would have been more relevant at the time, but I wanted to get that question out there. But so session lengths, 30, 45, 60 minutes. You talked about that. And, why might you choose to do like 45 minutes versus 30 minutes? I mean, even 60 minutes. I mean, you've talked a little bit about it, but I'm also kind of thinking just in terms of like, you talked about, maybe you do a 45-minute appointment and then you have 15 minutes to write your note or take a break or go to use the bathroom or something like that. Are there different strategies with that as well? Is it like, hey, maybe you want to do a 3-hour bender and then 1 hour off, and then another 3-hour bender? I don't know. But figured I'd ask.
I like referencing seeing patients as going on a bender, rather than seeing how many beers you can drink. Yeah, I mean, there's lots of, I've met many, right? I've worked with probably 1,000 clinicians, and so in the old days, there are lots of people that would rather crank out 2 or 3 back-to-back 45-minute sessions and then have like a 30 or 45-minute block to do the notes, right? It gives you, it's hectic. Like I don't like doing that. Occasionally I will to get someone in, but it makes it hectic. There's high pressure to finish on time, and that's not always easy as a mental health practitioner. But some people then really enjoy, 45 minutes to write my notes. I can get a cup of tea. There's less pressure. Again, I think with the right AI note-taking service, it's altered that. So now to the point, you could do 3 45-minute sessions and maybe your notes are 15 minutes, and then you really have a half hour to, go on TikTok or look at that rare Pokemon card on eBay or, whatever you're going to be doing. And, it is this, right? So if you're a therapist or a psychologist doing pure time-based billing, if you're doing 45-minute sessions, you're already giving 7 minutes of your time for free to your patient if you're using standard bill codes. So why are people doing that? What is it may not seem like a lot for one patient, but let's say you're doing 6 hours a day and you're doing 45-minute instead of 38-minute visits, which is the threshold for 90834. So that's 42 minutes a day that you're not being compensated for. That's like a big chunk, right? And so then 5 days a week, 200, that's over 3 hours a week. You're just almost a half day a week. You're just doing pro bono services. So there are these questions around what is your time worth? Why should you even be doing 45-minute sessions, right? It should be 38-minute sessions, or it should be 53-minute sessions. If you're going to do, it shouldn't be 60, it should be 53 minutes. I think for prescribers who should be billing E&M on complexity and then the time-based billing, you need to have a few minutes, quote, to do your complexity calculations in your brain for various documenting and insurance reasons, even though there's nothing written down and it's sort of an impossible thing to track that. How are you going to compare how long it takes one person to do their complexity calculation versus another? And you're not allowed to count therapy time as complexity time. But anyway, so it sort of makes more sense for prescribers to set these 30, 45, 60. But for non-prescribers on time-based billing, it's very reasonable to do 40-minute appointments. And then if you think about it, Parker, you could do 3 40-minute appointments in 2 hours. If you're doing 45 minutes appointments, but blocking an hour for each, that's like 3 hours of your time that you're giving up. And so the more patients you see, the more revenue you generate and the more people you're helping. So that's the balance we're talking about in deciding appointment time.
So what about balancing what the patient really wants for their appointment time. Yeah. What if, well, I mean, you work with kids. So, I mean, we've talked about this plenty of times that there's, a natural desire for those 3 to 6 appointment times for minor patients. But, even taking that out, just patients in general having a preference for an appointment time, how do you, you need to still maintain some efficiency and manage your workload. And I do imagine, seeing kids, you also then might ask some of them to, see you earlier in the day, but, can you do that? Can you do that consistently? So yeah, how do you manage all that? How do you make it efficient?
Yeah, that's a great question, right? So if you're, and we see adults also, and it tends to be parents of the kids we see, and young adults, and kids in college. That's how you can fill some of those morning hours. But yeah, if you do work with kids, those afternoon slots, often that's where we wind up putting in some back-to-backs just to get in an extra patient in those after school hours, because that's when it's best for kids to come. I think if you're seeing a kid once a month who's pretty stable on a medication, that it's less of a big deal to pull a kid out of school for an hour. But regular patients, you don't want to be pulling them out of school. So that can be a factor. Yeah, and then your patient good care ultimately is what I think drives this decision more than some of the budget piece. And because if you're cramming people in for purely monetary or budget reasons, it's a good way to burn yourself out. So taking the time and thinking, okay, this is a difficult parent work we're doing, or couples counseling. It's very hard to finish those in 45 minutes. Let's just block the 60 minutes for those cases. The kid cases are actually much easier to finish on time. Kids are good at knowing when it's time to stop. It's harder to cut off young adults and parents, or grown-ups in general are worse about knowing those boundaries.
I didn't think about that. Yeah.
Even with
We
the
leave meetings late, arrived to meetings late, but couldn't show up late to school. Or you knew exactly when English class was going to end so that you could head on out, go to lunch,
Yeah. And so there are these other, for kids that I would see, for kids who are pretty stable, you see once a month, often we would bring the parent in also to get the update from the parent. The problem with doing that is then the parent can tend to just chat the whole time, and depending on the age of the kid, you need to have that engagement and rapport and let them have some fun in the session, or it's like, why do I want to go there to listen to my mom say bad things about me to the doctor? So a strategy we do a lot is schedule a parent session the day before or the day after, so that when the kid comes, you can really just bring the kid in and engage with them, lay your eyes on them and do that appointment. And the parent, doesn't take away from that time of the kid spending with you, that you're working hard to keep them engaged in treatment and excited to see you. And it's a key factor for success. So that's a good strategy to keep your sessions from running over. Like, hey, lots to talk about, mom and dad, let's just get our own time scheduled for tomorrow and keep that one to 30 minutes. So see the kid for 45, but keep the parent session to 25 minutes is a strategy that works well.
Okay, so let's talk a little bit about growth. And you're talking about, you don't want to just try to see more patients in order to gain more money. At a certain point, too many patients is too many patients, right? And maybe you need somebody else to join your practice. And if you want to grow, you need somebody else to join your practice and see some of the patients that you can't, that you don't have the time to see. What are some scheduling strategies to optimize that practice growth? Like adding new people, making sure that you've got the availability for, some extra demand, but then also making sure that your wait list isn't too long, and making sure that you're avoiding burning yourself out, burning out your new clinicians. Let's get into it.
Yeah, and if it's a podcast, but what we do, Parker, at our clinic is we make a calendar for all our clinicians, and that calendar is sort of includes your regular patients, and then it includes spots for follow-up, and it includes spots for intakes. And for each clinician, you're going to look at it. It's always a 2-week schedule, because there are every other week therapy visits are very common. And that is a way that you can actually increase some access with, like, if your clinic is full, or you do have that wait list. We do know that every other week therapy can be as good as weekly therapy, but once a month, once every 4-week therapy is not. But if you're able to do every other week therapy, that's 2 patients you could see instead of 1. But you make your regular calendar, and you make sure that, if you're working 24 hours a week, you can't have 20 hours of that filled with regular patients. It's gonna, well, I shouldn't say it like that. For people who unless all of your patients are just regular weekly patients, then you could have all 24 hours just with patients in there. As soon as someone's better, it becomes an intake spot. But almost every mental health clinician has people they see once every 2 weeks or 3 weeks or 4 weeks, or as needed. So you really need to have these designated times available and open to meet the needs of the demand for the patients in your clinic. So for our psychiatrists, who all do therapy as well, if you're a 20-hour a week provider, you really 60% of that, if 12 hours a week is sort of set with regular patients, that those spots aren't open, then you can divide up the other 4 clinical hours a week, because there's admin time in that 20 hours. And hey, these are the times that are going to stay open for follow-ups. And you always want to have a couple of hours in after school time if you see kids, and then maybe a couple hours somewhere else. But that's how we see how many more cases we can take. That's how we know if we're doing a new intake. Hey, well, we could do an assessment, and maybe we can offer, a 30-minute spot every other week, but we need to know what our availability is. So in that wrap-up session for the assessment, and this is the sort of thing where if this patient really needs weekly therapy, you do want to be very clear about, here's the time I have, here's what we can offer, right? Maybe you're a psychologist and you've got an every other week spot. You want to be very clear and open with your patients, maybe before you schedule them, that, hey, here's what I have available. Are you still interested in doing an intake? So doing that planning so you don't find yourself in a tight spot is very important.
Okay.
And I'm thinking we should, I can make that template available for our clients as well. And it might be something that's helpful with some of our other templates.
That is true. I mean, we do offer a number of different templates to our RipsyTech customers for helping them run their practice efficiently. So if anybody's interested in those and they're not a RipsyTech customer, reach out, schedule a demo. Let's have a chat. Okay, so I believe now would be a good time to talk about the mental health business moment. And I don't want to get ahead of myself, but I think you have something that might be slightly relevant to all of this, of what we've been talking about. What do you have?
Yeah, so it's maybe it's not a mental health business moment, but it is tied in, but it's, we're constantly looking at ways to actually decrease that note writing time. And so we have we have put together an AI research team that's going to be undergoing different projects, and one of them is going to be, we already have a sort of billing predictor, but can we do even better with some of the billing piece? And I think it was some of the young doctors on the research team are very um, excited about what AI can do. And it stood
Mm-hmm.
out to me because we actually pulled up our AI dashboard and quickly gave AI 2 sentences to analyze a note and plugged in a note. And when it came out with this response, the doctor said like amazing, like just couldn't contain the some of the excitement around what AI can do when used in the
Mm-hmm.
right context. And so we're going to undertake a research project, kind of doing lots of things with AI and billing and with the note process that, yeah, will then lend itself to a lot of pieces of optimizing scheduling and other things along that realm. So
Is this the promise of AI? That is this the big differentiator that it's going to make for this industry? That you'll be able to see more patients and increase potential access to care by having the AI help you get your notes done quicker. Hmm.
that's the win-win potentially. I think it remains to be seen, and we're sort of looking at this also, that if you do actually get time back, if we get you those 42 minutes back in a day, what does that mean? You're actually going to see another patient, or does it mean you're going to,
Mm.
take a walk outside and get some exercise? That would,
I mean, both are good options for two different types of people, or the person that says, today I'm gonna lock in and see another patient, or today I'm going to lock out, or walk out and get a breath of fresh air. Yeah. Okay. I was, frankly, I said I wasn't going to assume what your mental health business moment was anymore when I asked you what the mental health business moment was. Um, and I was also wrong again this time. I was trying to reference that you mentioned that you had seen a higher number of patients this week
uh,
compared to normal. And that did feel relevant to bring up. I'm also not sure after now having this conversation if it's something that I should congratulate you for, or if I should ask if you're doing okay, or are you burned out? Are you seeing too many patients, Tom?
yeah, no, I think, like, I'm a gamer, so I sort of like to gamify things. And
Mm,
I did, yeah, it set I split my two full-time jobs, but I did set a record for the number of patients seen this week. And that included a no-show. So I was sort of bummed about the no-show, because then that
wow.
would have pushed that record number further. Um, and yeah, it's interesting. In general, the majority of my sessions are 45-minute sessions.
Hmm.
And so there's sort of a hourly goal that we tell people to set for themselves about what they're going to earn per hour. Definitely in my mind, I sort of jump to how much do you earn per patient. And I think I do that because in psychiatry, the differential between a 25-minute visit and a 45 minute visit is like 10%. It's very low.
Mm,
And
hmm.
for, some of the 25-minute visits this week, I, earned more revenue from the insurance companies than for the 45-minute visits.
Right.
Yeah. So I definitely tend to go by patient visits versus time. And even though I tell when you're doing your budget, that's not the right way to do it. You need to do it by, yeah, money. You need to be more accurate. But
Right. Right. All right. Well, this has been a beefy episode. We said we were gonna try and get this one done a little bit quicker, and we just went on and on. That's what happens when you don't record for 2 weeks. We have a lot to say. A lot can happen in 2 weeks. So I will go ahead and wrap things up here. Thank you for all of the information as always, Tom. You are an infinite wealth of it, and hopefully we'll hit episode infinity in no time. All right, that's it for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, please leave us a rating or review on whatever platform you are consuming this on, or listening on. I guess it would be the more normal thing to say. And if you'd like to get in touch, you can always email us at sitandstay@ripsytech.com. All right, Tom, it was great having you. I will see you next time.
Sounds good, Tal. And make sure our patients don't go on a RipsyTech podcast bender. That could be bad.
A RipsyTech podcast bender sounds like a good thing. I don't know. I'd like to see it. Anyway.
All right. Thanks, Parker.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.